I first became interested in social justice as a very young child. My father was the director of the War on Poverty programs, and my mother was the first Black teacher in the town where I grew up in Pennsylvania. And they were both engaged in various forms of community organizing for social justice throughout my childhood and youth. So I've been a part of many movements, not only the reproductive justice movement over the years, but that was because that was demonstrated to me as a young person. And it was my parents saw it in their parents and those before them. Every generation has what they can carry forward to make things better for those that will come after them.
That was Dr. Lynn Roberts. Hello and welcome everybody to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon from the Office of Online Learning here at CUNY SPH. Each episode of Making Public Health Personal focuses on an aspect of health and social justice that affects our daily lives. We'll learn from expert faculty, researchers, alumni, and students on how public health policy, advocacy, and practices can benefit our ever-evolving community and our world. You don't have to work in healthcare or have a PhD to understand these topics. We're going to break them down for you and give you practical tips to make a difference. Today's guest is Dr. Lynn Roberts. She is the Associate Dean of Student Affairs and Alumni Relations, and also teaches in the Department of Community Health and Social Sciences here at CUNY SPH. She is the co-editor and contributing author of an acclaimed anthology titled Radical Reproductive Justice: Foundations, Theory, Practice, Critique. She is an emeritus board member of the SisterSong Women of Color Reproductive Justice Collective. Dr. Roberts studies the intersections of race, class, and gender in adolescent dating relationships, juvenile justice, and reproductive health policies and practice. In today's episode, we'll be hearing about the collective efforts to advance sexual and reproductive health, rights, and justice through community building, organizing, and mobilizing. I'm so glad to be talking with you today, Lynn. Thanks for joining the podcast.
Thank you, Laura. So glad to be here.
So a lot of your work is focused around what people call reproductive justice. And for our listeners, how would you define that, reproductive justice?
Reproductive justice is a framework, and it's also a social movement. The term was first coined by a caucus of 12 Black women in 1994 to articulate the needs of communities of color and Indigenous communities that face multiple and intersecting forms of sexual and reproductive oppression. The framework itself is based on 4 key principles that assert the fundamental human right to 1, decide if and when you will have a child and the conditions under which you will give birth or create a family. 2, to decide if you will not have a child and to consider your options for preventing or terminating a pregnancy. 3, to parent with the necessary social supports in safe environments and healthy communities without any threat of harm from individuals or organizations or the government. And 4, the right to bodily autonomy, free from any form of sexual or reproductive oppression.
So it's not just about abortion.
Yes, that's exactly right. It's not just about abortion, and it removes the false binary of those who are pro-life and pro-choice. The reproductive justice framework and movement have always included and embraced folks across a wide spectrum of beliefs about abortion. And it draws a clear line between who gets to decide what is best for any individual person or community of people, and not the state.
So tell us about your contribution to the anthology Radical Reproductive Justice.
So I've always been on this quest to tell my own story differently, to be able to relate who I am beyond people's preconceived notions about young parents. And before I had ever heard of reproductive justice, my own story was a part of a reproductive justice framing. And one of the things I talk about in the anthology in my contributed essay is about the 4 generations of motherhood in my own family. So it's my grandmother's story and my mother's story and my own story, and now my 2 daughters' story about our reproductive journeys to motherhood and all that entailed, and how important it is to bring forth people's stories and understand them in the context of the larger society in order to understand what we can change in terms of providing what everyone needs to thrive in life. And some of that is very basic, but when you think about it from a public health standpoint and social justice standpoint, it can seem daunting. It can feel daunting because we want to make the world a better place for everyone. And there are all these, seemingly daunting barriers to that. But at the end of the day, there are policies that you can change that actually existed. So when I was in 1979, there were no barriers to me pursuing my education, my college education, and still receiving, public benefits like Medicaid or Section 8 to have housing while I was a young parent and a doctoral student. But just like you can construct policies that are barriers, you can create policies that are supportive and that make things much easier. And you can create access that didn't exist before. And you can also shift resources. Instead of funding things that cause more harm, you can shift resources to things that are much more supportive of health and well-being. But that comes with people engaging in telling, the stories that don't always get told. And so, as the feminist anthem that the personal is political, it certainly, is, but it also means that the personal can be liberating and can be an opportunity for social change.
So it sounds like you have a very deeply personal story of why you're committed to radical reproductive justice. And it also has a much bigger impact.
I don't think everyone has to have had, certainly has to have been a teen mom to care about reproductive justice. So I think it's just as important for people to find something that matters to them and that they would like to become engaged in changing and to join with others to make that happen.
If you could tell us a bit about the First Steps program. I know it aims to keep families with substance abuse together. That would be helpful.
Sure. In the early 1990s, I had the privilege to direct a program based in Harlem to provide outpatient drug treatment, visiting nurse services, and comprehensive support services to prevent the removal of infants and young children from their families strictly on the basis of their parents' use of alcohol and illegal substances. Before I had ever heard the term reproductive justice, this program was a small attempt to realize the second principle of the reproductive justice framework, which is the right to parent.
Mm-hmm.
The foster care system and punitive policies that criminalize substance use have disproportionately impacted Black, Brown, Indigenous, and poor families.
So what are those unique challenges that women of color face when it comes to reproductive justice? You mentioned one of them.
So Indigenous and communities of color, and not only cisgender women, experience a myriad of challenges related to reproductive injustice, both historically and at present. So from a historical perspective, and in addition to the barbaric exploitation of their labor, enslaved women of African descent were raped and forced to breed, only to have their children sold as chattel. Between 1845, 1849, the founder of modern gynecology, or the person considered to be the founder of modern gynecology, J. Marion Sims, experimented on enslaved African and poor immigrant women and their infants without anesthesia that was available at the time to perfect surgical procedures for privileged white women. The eugenics movement sought to increase births among those who were deemed to be, quote unquote, mentally fit and decrease births among those deemed to be, quote unquote, unfit. From the late 1800s until the early 1970s, Native American children were removed from their families and sent to boarding schools to civilize and remove, quote unquote, the Indian from them. And there have been numerous cases of sterilization abuse by the US government and medical institutions that specifically targeted Puerto Rican women, African American women, and girls in North Carolina for what Fannie Lou Hamer described as the Mississippi appendectomy, as well as Native American women on reservations and Mexican American women in California. And more recently, we have witnessed restrictions on comprehensive sex education in schools, coercive uses of contraceptives, restrictions on access to abortion, discriminatory early termination of parental rights, the separation of children from their parents through both foster care and immigration enforcement, the demonization and criminalization of pregnant and parenting women and girls based on our age, our substance use, and being poor. And most recently, we have seen the specter of reproductive injustice arise during COVID-19 and with the continued rise in abuse of women in detention. The Black maternal mortality rate nationwide is 3 to 4 times the rate for white women. And in New York City, it has been as high as 12 times higher.
So it sounds like there are a huge number of injustices and things that need to be fought for. And it's not just women of color, it's people with disabilities, people in the LGBTQIA community, people that just don't have a voice. So the work you're doing is really, really important.
Absolutely. And reproductive justice examines all issues through an intersectional lens. That's when we speak about communities most impacted by sexual and reproductive oppression or injustices. We are addressing their multiple identities as people of color, as folks with disabilities, as folks who are lesbian, gay, bisexual, queer, intersex, asexual, transgender, non-binary, two-spirit, and gender non-conforming, who are poor, who are undocumented, and I could go on. As a movement, reproductive justice recognizes that all of us have a voice. And what we seek to do is amplify the voices of those who are most deeply impacted by these historical injustices in our research, in our program design, and in the shaping of public policies.
So you mentioned your research and specifically speaking about intersections of race, class, and gender in adolescent dating relationships, I know is some of your research. Can you tell us a bit about that?
Sure. So the study that I conducted is very much a part of my work as a reproductive justice scholar activist and was, conducted some time ago and published more recently around 2018. And in the study, we found that adolescents reporting both racial and gender discrimination were 2.5 times more likely to experience dating violence as those who were harmed, as well as those who caused the harm, compared to those who did not report racial and gender discrimination. And that was after controlling for age and sex. So this study was, taking an intersectional approach, very similar to the reproductive justice framework. It was also embracing some aspects of critical race theory, which is coming under attack in our schools and elsewhere. And I considered it just part of an increasing, burgeoning area of research that is, much more intersectional, grounded in theories such as the reproductive justice framework, such as critical race theory. And that's exciting, but the research is not enough if that research doesn't lead to action. So the design of our studies, who we include from the very beginning in conceptualizing the design of our research, all of that matters when we're talking about being in tune with what's happening in the world around us. And also, that there be a bridge between social justice activism and scholarly pursuits.
So we've spoke to some guests in the past who've told us about their research and how it led to different social programs, maybe with the Department of Health, things like that. The reproductive justice movement seems like something that really could benefit from having community organizing. And that's something that you teach in your courses. A lot of people might think immediately when you hear community organizing, you're thinking of protesting or joining rallies. How would you define community organizing?
Well, I define community organizing quite simply as the strategy or strategies of collective action to improve people's lives based on a fundamental, unquenchable desire for social, economic, political, reproductive, environmental, climate, electoral, and I could go on, justice. So all these different forms of justice, social justice more broadly that we seek, but doing it collectively and not individually, and grounding it again in real people's lives where they are engaged with each other. So it does include protesting, or what I like to refer to more explicitly as direct actions. So direct actions, every protest that you see isn't necessarily a direct action if it doesn't confront those who are in a position to do something about the issue.
Exactly.
Sometimes those protests are just as important if they build solidarity among people, make them feel connected to something larger than themselves. And in my classroom, what I hope to do is to instill in students of public health, and specifically community health and social sciences, in the department of which I teach the course is that they are very in tune with their role as public health professionals to also engage as actors in changing the inequitable and unjust conditions in our society that detract from public health.
So sharing information, forming people about it.
And also that there are theories, that there's a theoretical basis for what organizers do, and that they have tools that they use, that they have, strategies that have been tried, over time to bring, most of what we have that we consider supportive of public health came about through community organizing. Public health itself was founded on social justice. So was people, organizing and mobilizing to change policies. And that's really how policies change. It's not just, individuals advocating for those changes. If you don't get people engaged and informed to be collective actors, chances are things aren't going to, result in significant change. And sometimes it's just creating the environment for there to be a cultural shift to make those changes in policy possible.
So I think a good example of someone who was good at coalition building and community organizing was Barack Obama. Well,
if you read his first autobiography, I guess, you certainly get a sense of what he was engaged in. As a young person in Chicago, he was exposed to organizers who were trained in the Alinsky tradition, which I also teach my students about. But I also introduce newer models of community organizing that were informed by, some of the feminist movements, and certainly more recently by the reproductive justice movement, where different communities have shaped the toolkit, if you will, that we use in community organizing to bring people together and to organize maybe around, different identities that have come to raise their voices and to be heard in ways that maybe weren't, utilized in the past, to be, more innovative and to come up with new strategies of telling their own story and being able to use the new technologies.
Yeah, that's got to be a big game changer for all the theories, right? The digital age.
Absolutely. And at the same time, there will always be a need to still come together face to face with people and in person. We saw that happen in the spring of 2020 in the midst of one of the most significant pandemics of my lifetime, where people risked their own health and safety to demand racial justice in the aftermath of the extrajudicial killing of George Floyd and so many others. So, the very idea that you can have these technologies to enhance some of the older tools, but also that there are some fundamentals that are still necessary, where people, we may not feel as safe doing door knocking, knocking on doors to engage with people, at least for the immediate, short term. But on the other hand, you have to build relationships. So if you find creative ways to do that with digital technology, all the better. But one of the risks, and this gets debated a lot, is that it can also exclude, right? So those who don't have that access, then you're going to be less effective. If a community that you want to engage and mobilize doesn't have access to the technology, then that's going to be a hindrance. And at the same time, you can expand your reach through technology to communities that ordinarily wouldn't be able to connect with one another because of geographical barriers. So now we can organize with people all around the world on the same or related issues, and that expands the capacity. And we've seen that in so many movements more recently with Occupy Wall Street, which is much more than what happened at Zuccotti Park, and which really also shifted a narrative significantly about, the wide disparities in wealth.
Absolutely.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
So, who can be an advocate for reproductive justice? How can people who are not in those most negatively impacted groups be part of this movement?
Everyone and anyone can be in. Well, and I'd like to say that anyone and everyone can recognize the injustices and can be, and if they're not familiar, can become educated and have their consciousness raised. And once that happens, they can also learn to become good allies so that they aren't speaking for people. So they aren't necessarily advocates for, but they are supporters of those who are directly impacted to make sure that they are heard by maybe creating space, maybe even stepping back, but ensuring that that happens. And some of the ways that happens is by people who are in positions of influence, who may be gatekeepers, to create a pathway for that. When they are in positions where they can make it possible for others to have access that wouldn't otherwise be available, that they do that. So I like to think of what I do in the classroom is create infiltrators, right? People who infiltrate those spaces that are locked doors and closed doors
and glass ceilings
and break that so that others have those opportunities, and really to mean it. And I like to say that it's important to have outsiders who think like insiders so that they are willing to engage with those and not only critique them. So they're willing to work with the insiders who they can and not reject the entire system as opposed to what they're trying to accomplish. And then we need insiders who think like outsiders, however they come to that understanding, who appreciate that those who are outside these power enclaves actually can have theories of change and ideas and solutions worth considering. But you need both for the wheels to turn, for the change to happen. That's relationship building, and it takes time, and to sustain it over time. Sometimes you have critical moments that happen that you take advantage of, where you have more of this mass mobilization. But the real work begins when you have to be in coalition with folks with whom you don't always agree, and build trust and relationships over time. And that's the harder work that's often invisible of organizing, that many don't see because it doesn't make the 7:00 news. It doesn't get written up in the newspapers.
True. And I'm sure it's much harder when those things are not in the news to inform people of some of the injustices that have happened for people that they don't know personally. You're talking generations back, that someone who maybe is not of that race, maybe doesn't have friends who have family members that went through that, and they're just not aware. And how do you make those people care,
Sure. And that's where, again, the creative toolkit happens. So one of the roles that many organizers perform is that of cultural work, and to be folks who use creative ways of sharing information through the arts, through various forms of storytelling, in order to really engage people in ways that statistics and more traditional tools of science, really don't convey. But that doesn't mean that they can't coexist.
Absolutely.
And so having a wide range of tools in the toolkit, a wide range of methodologies is really critical.
How can someone who's passionate about social justice or a public health issue in general get involved and make a difference?
Well, I think it requires each of us to consider our own individual values and what matters to us. And I ask students in my class to choose an issue that they feel passionately about and go with it, whatever that is. And chances are everyone has had someone, or they themselves have been impacted by some social injustice. At some point in the history of their family, their community of identity. And, I don't think, we're as far removed from these things as most people let on. And it also doesn't mean that we can't have empathy for those if we haven't had a shared experience. So being able to see also that when others come together, it does make a difference. So whether that's just validation and people feeling heard, but also seeing that most change that has happened in our world, in our society over time has come about because that's exactly what people did. They joined with others. They didn't stay in their own little isolated part of the world and only, contemplate what could make a difference. And they saw change happen. They saw things, whether it's incremental or more, sweeping. And it's usually much more incremental. And that can be frustrating for folks who want to see more significant change more quickly and who get tired and start to feel despair.
Yeah, it can be hard with a lot going on in the whole country and it seems to pile up. And if you have a narrow view of time and what's happening in the past, you count by 4 years sometimes by who's president. It could seem like a lot going on.
Absolutely. And you can't only tell the stories of the injustices. So you have to tell the stories of the resistance and the persevering. And when you think about that and you think of things that as someone whose ancestors were enslaved once, if they didn't believe that abolition was possible, I probably wouldn't be here. Our family histories tell us that it's possible. And yet they also tell us of, those who didn't make it. But we have to hold both of those truths. And I think what sustains hope is also seeing what's possible in other people's journeys. And again, going back to, however way we need to do that and to share that as widely as possible and to counter the misinformation and the counter narratives that are really at a full tilt right now, really requires us to also hone in what's close to us and expand that to also consider what's not so close to us and that we all, have our own path and journey to feeling more hopeful. And yet I think that is what sustains social movements. And yet sometimes people do have to step away and take a pause and find the joy in life in whatever way they need to do that so that they can restore their energies to return to it when they're in a better position to do so.
And to fight another day.
And that it's not done by individuals, leaders, for example. So sometimes there's a romanticizing individuals who we hold as being responsible for entire social justice victories. It's the Dr. Kings and the Rosa Parks. It isn't the ordinary people who supported their efforts and were courageous in their own right in ways that we don't know about, so that we can see ourselves as being those individuals. Because most of us don't see ourselves as being this iconic figure. We see ourselves as more ordinary, right?
Yeah.
At least I do.
And it's less overwhelming, I
right,
guess, to be one of many than to be the one.
And that's what has done the work. Like Dr. King existed because of that. And to not recognize that, and also collective leaders and many of the movements today, and what I like about the younger generation of movement builders is that they see that. They're doing that intentionally and they're lifting that up. We don't need single leaders who then are easy to take out or assassinate, because then that instills fear in others to even, participate. So it's much easier if they don't know who your leaders are, because you are all leaders. And that's what Black Lives Matter and Occupy Wall Street demonstrated, that that we are all leaders and we are more powerful together than we are individually. And that's also how reproductive justice operates through the SisterSong, Women of Color, Reproductive Justice Collective, and others, movements of, it's a very feminist approach to organizing that's been with us for many decades before reproductive justice was named. Organizing has always been a part of our collective histories, herstories on this planet, and will be with us for a long time to come.
Thanks, Dr. Roberts. And thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. I want to give a special thanks to our guest today, Dr. Lynn Roberts, and let you know that all the links and resources we discussed in today's episode are available in the description below. To find out more about CUNY SPH and our programs, you can visit sph.cuny.edu or connect with us on social media. I hope you enjoy the summer, and we'll be back with all new episodes of this podcast in the fall. In the meantime, you can share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, and on our YouTube channel. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.